Welcome to the Why Did I Get Cancer podcast. I'm Deborah Herlax-Enos, a small-town girl turned TV nutritionist and healthy living expert. I design health programs for the average guy or gal, including those average guys named Metallica. On September 1st, 2020, I was diagnosed with breast cancer. I asked every oncologist the same question, why did I get cancer? But none of my doctors had good answers for me. I wanted answers, and that's why I started this podcast. I want to help you to lower your cancer risk and provide self-care tips for those in the battle. I'm getting answers, and I want to share them with you. Welcome to my podcast with Dr. Laura James. She was my naturopathic oncologist during my cancer journey. And I got to tell you, I just had a couple of great takeaways with her. One of the things that she talked about was that breast cancer is an opportunity to set boundaries. And I could not agree with that more. Breast cancer really cured me of being a people pleaser. And it also cured me of being too focused on how people felt about me. So that was, if there's a gift in breast cancer, that was my gift. The other thing we talked about was the breast cancer industrial complex. And what she talks about with that is how it is literally a bullet train from diagnosis to treatment. And everything just seems to be going so fast that you don't really get a chance to just slow down, push the pause button, think, pray, get a second opinion, and that it's easy to get caught up in this system. And that's not always doing us a favor. Of course, there are some cancers where you need to have very aggressive treatment. But in most cases, she was saying you can push the pause button for a day. Think about it. Again, gather your thoughts and really make informed decisions. So you got to listen to the rest of the podcast. It was just full of information. And then don't forget to look at the show notes. She had multiple resources for anybody going through cancer, or if you have a friend who's going through it. Honestly, just a really empowering conversation. Hope you enjoy it. Welcome to my favorite naturopathic oncologist, Dr. Laura James, who was my naturopathic oncologist. Welcome to Why Did I Get Cancer? I haven't seen you, luckily, in a couple of years, no offense. And we've got a lot to unpack today.
Yes, we do. Thank you for having me here, Deborah.
Yes.
I'm really happy to be back. And I think we're going to talk about some topics that I'm really excited to talk about for your audience.
Yeah, I'm really excited about it too. And this is a topic I actually haven't really talked that much about before because I will admit it makes me sound ungrateful. And I don't want to sound ungrateful at all. And here's what I mean by that is cancer treatment happened so fast for me. And I realized I've got great health insurance, and it was also during COVID, and hospitals weren't busy and they could just get me in right away, which was amazing. But it also didn't give me a lot of time to think and to process and to pray and to seek second opinions. So I feel like I got a little bit caught up in what you call the breast cancer industrial complex. Okay, can you unpack that?
Sure. You did get caught up in what I call the breast cancer industrial complex, and all women get caught up in the same complex. This is really my term for what is standard of care in the United States regarding breast cancer diagnosis and treatment. And so when a woman seeks out her initial care, whether it's with a primary care physician to feel a lump, or she goes for her screening mammogram because it's time and something is found, as soon as something is identified in the breast, in the conventional world, the clock starts ticking. And there is an immediate reaction that triggers all the things that happen from there. And it can end up feeling like an avalanche of information and of appointments and of time. And every woman I talk to, and at this point, I have practiced medicine for 22 years and I've counseled thousands of women with breast cancer. Every woman feels like all of a sudden they're on the bullet train to
Yes.
wherever they're going. And many women, and I find this to be sort of age delineated. There's certainly, I wanna say women who are older being diagnosed with breast cancer who
Mhm.
may still be of the mindset that whatever the white coat doctor says is what they
Mhm.
have to follow.
Right.
And then sort of generationally, I think people are more questioning about what standard of care is presented to them, right?
Mhm.
And, but in all cases, regardless of age and regardless of opinions, I think women feel railroaded into making decisions about major parts of their bodies, right?
Right.
Um, and I have practiced medicine largely in Washington State. I've also practiced medicine in Hawaii for a short period of time, and so I have some experience with how breast oncology in particular is practiced in a couple different places. And then certainly I've had patients who travel to big academic medical centers like MD Anderson in Texas or Sloan Kettering in New York.
Mhm.
I've had patients travel for second opinions, and there certainly are regional differences in how this experience is presented for women. Um, but I've also had women have doctors say to them when they ask questions about their care, "Oh, we don't do that here." Or,
Mhm.
"Oh, I'm not gonna give you a percentage of benefit because we don't do that." Which I think frankly is criminal because women need
Yeah.
to know exactly what the percentages of benefit are for all of their choices for their individual breast cancer, for their stage and their pathology,
Right. Right.
right?
Just give me the information, and I would also say respectfully allow me the space to process it. Not everybody is a bullet train processor, and I felt a lot of pressure. And again, I know this potentially sounds like I'm just, looking back and I'm ungrateful, and I'm not. I mean, maybe I would have made the same decisions moving forward to have my breast removed, but everything was so fast. I had 4 surgeries in 5 months, and it was really rough on my body. It was I mean, you asked me before we even started, "How are you feeling?" And I thought, "You know what? It's been 3.5 years, and I finally feel great." But it has been a journey to get to great, and I've had to
Right.
work really hard, and I don't know if you remember, but I also had some cognitive decline from
Mhm.
I think we had discussed all the surgeries so quickly and being under anesthesia for so long, and, it was a lot to get my brain back even,
Yeah.
and, so again, Monday morning quarterbacking, I don't know if I would do the same thing, but I was intrigued by your concept of this, breast cancer complex,
I
industrial
think that,
complex.
there's a lot of rationale for having standard of care, right? And standard of care is what conventional oncology is going to offer every patient who walks in the door with a diagnosis of breast cancer.
Mhm,
And, standard of care is based on clinical data. And it is the roadmap that conventional oncology can offer. And so that, there's a lot of rationale for that roadmap, but there's
mhm,
also a lot of nuance within that roadmap about how people can navigate it. And I think one of the things that people have to remember in this whole concept of dealing with being on the bullet train is navigating healthcare in this country is very, very difficult. And
mhm,
for people who have absolutely no experience, either personally or with a family member or with a friend, it is, whoo, it'll blow your hair back, right? As soon as you
Yeah.
walk in the door of any of these facilities. And, there's a language barrier, right? There's an
Yeah, there
insurance
is.
barrier, right?
Mhm.
And from the perspective of the conventional group, and I know this because I've worked alongside conventional groups for a long time, there's a time issue on their part, right?
Mhm. Yeah.
And so there's that workflow issue. And what I hear from women all the time is, I didn't have enough time to talk to my provider, or this concept of, whatever wasn't brought up in the visit. And I didn't get the referrals I needed for the other things, right?
Mhm.
And it's
Right.
all because we have this insurance driven, which is a bunch of suits deciding how medicine is going to be practiced, right?
Right.
Um,
Right.
and so time gets whittled down. um, and, I think
Mm.
if a woman is lucky in a conventional setting, she might have a nurse navigator who's part of her team. And a nurse navigator is, a position that a lot of cancer centers have, but a lot of cancer centers don't. And,
Mhm.
it's a nurse provider who's there to help translate and provide resources and
Mhm.
be a point person, right? And I feel like every woman needs a point person like that in this
They do.
process.
They do. Anybody going through any kind of a diagnosis needs a person who has some
Mhm,
experience, and,
mhm,
um, I think one of the things I found most challenging, and it was right at the beginning before I was even diagnosed, and I went back, I had a bad mammo, I went back for a biopsy, and then they took me into this little side room, and this woman sat down with me and said, "Okay, here's what cancer treatment looks like." And she went through this whole, like, here's what it looks like, here's what chemo looks like, here's what, and just did this whole thing about here's what a cancer journey looks like. And I said, I'm bawling at this point because I just had a biopsy. And I said, "Did you already get my results back?" And she's like, "No, no, this is just like to prepare you just in case." And I thought,
Jeez.
really? Really? So I left. I was an emotional wreck. Get home, tell my husband, he's crying, I'm crying. And I'm like, oh my gosh, we don't even have the results back. And they're already, again, now looking back and thinking, I feel like it was almost a little bit of a setup.
Mhm.
Like, we just want to nab you in the beginning, kind of get you a little bit. Like, was that there to educate me in a respectful and honorable way? Or was that to just like, hey, once we get these results back, let's go down the bullet train highway?
I think it's more of a, standard of care is based on algorithms, right?
Mhm.
So if this, then this, but also it's a checking the box. And
Mm.
and so that cancer care education that you got is a box that can be checked regarding the insurance
Mm.
supported pathway of your diagnosis and the process of figuring out what to do. And
Mm.
this is the complex. It's the providers, it's the data, and it's the insurance companies, all of which are
Mm.
designed to work together, but they leave the patient out of the equation, right? It's the patient's
Right.
life. And they get, thrown into this industrial complex, and that's really what it is. It's the doctors,
Ugh.
it's the data, it's the insurance. And the insurance also doesn't always follow the data, right? They're
Right.
following the time and the money. And
Right.
so, how does a person break through all of that? And this is where, I'm doing a lot of research right now, and I'm doing a lot of speaking about this concept of resilience.
Mhm.
And this is a big concept in the world of of psychology, but it has so much applicability in the world of cancer because patients who have resilience, meaning they're able to deal with a traumatic event and then have post traumatic growth following it, patients who are able to be resilient do much better with a cancer diagnosis. And
Mhm.
part of being resilient is being able to step back, see
Mm.
what you're looking at, ask questions, and make informed decisions, because then there's that locus of control back with the patient, right? So
Yes.
ultimately,
Mhm.
having positive long-term outcomes is starts with the idea that someone is resilient and able to take those steps, right?
So, and your basic definition of resilience is maybe pushing the pause button and
Mhm.
just taking a moment or a couple of days or even a week to
Mhm.
process this information
Right.
before you go back and you make an informed, let's
Right.
emphasize, informed decision
Right.
about your own body.
Right. Exactly.
Okay. Yeah.
And, there certainly are women who push the pause button for too long,
For yeah, absolutely. Mhm.
right? And then there are the women who don't push the pause button at all and just get swept up in the whole thing and then
Mhm.
maybe have significant regrets,
Yeah.
right?
Yeah.
So, yes, a few days, a week, what, sometimes that can be naturally in place because getting appointments at the facility of choice might take some time, right?
Right.
In
Right.
which case you have a little bit of time.
Mhm.
But not, it sort of depends on where people are.
Yes, it really does. And let's go back to that resilience because I think maybe people listening right now might say, "Well, I'm not resilient or I'm not courageous or I'm not this or I'm not that." But you're saying resilience truly is just stepping back and maybe doing a little bit of self-care. And in that self-care, the answer, which could be intuition, it could be Holy Spirit, it could be, just a feeling of peace, allowing that process to happen.
Right. Resilience is the flip side of resilience is victimhood. And
That's
so
good. Yeah.
if if a woman gets a diagnosis of breast cancer and falls into this space of, "Oh, poor me. Oh, why does all this stuff happen to me all the time? Oh, there's nothing I can do about it. Oh, I'm a bad person because this all happened," whatever. Falling into that rabbit hole after a diagnosis really can influence the
Mm.
long-term outcomes
Yeah.
as well as side effect profile from drugs. I mean, it affects everything. People who doubt that the way we think and our mindset doesn't
Right.
influence what our outcomes are, it absolutely does. But
Right.
resilience in many ways is this core trait that many of us have, and it looks different in every individual, right?
Mhm.
But it's simply the ability to recover after a traumatic event and
Mm.
grow from that traumatic event, right?
Okay. Yeah, I like
And
that. And
yeah,
that is a really simple explanation.
yeah.
And yeah, and that yeah, that really is helpful.
One thing I do wanna emphasize, though, I just used the word trait. Resilience can actually be learned. It's not just an inherent personality trait, it can absolutely be learned and reinforced.
Okay, I like that. I
Mhm,
like that because we're all capable of learning new things,
mhm,
especially as we are, big T trauma or little T trauma, whatever it is, we all have the ability to learn new things and really grow from that experience.
mhm.
So let's talk a little bit about something you say, and I read this in your newsletter, and your quote is, "I'll just say it: breast cancer is a feminist issue." Okay, that is a big statement that I would love to hear more about?
Sure. Um, I like I said, I've counseled thousands of women with breast cancer,
Mhm.
and there are many, many pieces of the breast cancer puzzle that, in terms of a cancer puzzle, I think are very specific to women, particularly in America. And I say that because we don't have a lot of the social supports that women in other countries might enjoy.
Hmm.
We have places where people live that are extremely expensive, and women need to be working more than one job,
Mm.
particularly if they're single mothers.
Mhm.
Um, there's been, I think, in a lot of places, a dissolution of close family by different
Mm.
family members moving,
Yep.
right? And in many places, also just kind of a lack of community.
Mhm.
So from a social standpoint, when a woman gets breast cancer, it's almost like her normal life stops, and she has to
Mhm.
figure out how is she going to proceed as a woman with breast cancer with all of the responsibilities that she
S
has,
So
right?
true. Yep, so true.
And this is where you mentioned self-care. Self-care ultimately is setting boundaries. It's not
Mm.
taking a bubble bath, it's not going to a yoga class, it's setting boundaries.
Mhm.
And breast cancer is such an opportunity to set boundaries.
Mhm.
And, boundaries with one's partner, family, friends, workplace, physicians, and this is where the resilience really has to be nurtured, because all of that boundary setting is tiring.
It's
And
exhausting.
breast cancer is tiring, and,
Yes.
let's say you're a 40-year-old woman and you have 3 little kids under 10, and you work, and you
Mm.
have breast cancer. I mean, it's freaking impossible,
It sure feels like it. Yeah.
right?
Yep.
So, a breast cancer diagnosis shines a spotlight on a woman's ability to enable self-care, to set boundaries, and to navigate both her life and the breast cancer. We're of this generation where we were taught that we can do it all, right?
Yeah.
Bullshit.
It's it's totally bullshit.
It's
You're right.
bullshit.
It is.
I'm allowed to swear on podcasts, right?
Yes, and you yeah, I mean, to think that you can do it all, you're gonna end up in the hospital with an illness
Right.
because you
Mhm.
can't do it all, and then in that doing it all, you are trying to please everybody except the most important person, yourself.
Right, right.
Yep.
I think, I think America Ferrara's character in the Barbie movie
Ah, yeah.
said it for everybody. And,
Yeah.
part of what I'm trying to do in my work is really pull people into the Barbie van. Let's talk about breast cancer as a feminist issue. And, what I try and provide for women is an opportunity to talk about all of these things in
Mhm.
a non-judgmental setting with some time. And,
Yeah.
I there are multiple topics, along these lines for women with breast cancer that are not addressed in the breast cancer industrial complex. They're just not.
Mhm.
They're either not one of the check boxes, or they're not part of the algorithm, and so women either have to depend on their friends, and that can go lots of different ways,
Can't yep.
right?
Mhm.
Um, but to have an open setting where people can talk about how hard it is to maybe be a parent of young
Mhm.
children and be in chemo and be sick all the time, and to not have a partner who gets it, or
Right, and to still have to show up to work.
exactly.
That was
Exactly.
right, to show up to work and you're trying to bring your best self, and Boy, that was really tough for me. Yeah.
Yeah. Well, and I recently, like in the last year and a half or so, counseled a woman whose breast cancer was pretty aggressive and she needed to have pretty aggressive treatment. And fortunately, she was a really good navigator of her care, but her
Mhm.
workplace was draconian in
Wow.
what they were putting her through. And I was like, you can have FMLA, put in for FMLA. And basically her employer did what are ultimately illegal things. And
Wow.
and she was so afraid to raise her hand and say, I am entitled to FMLA. I am entitled to
Mhm.
accommodations in my workplace that don't put me at risk. They weren't giving her accommodations. They were making her go out into public when she was on chemotherapy and she
Oh,
was
wow.
requesting to work from home. And they were basically trying to force her to quit, right? So that they wouldn't have to be giving her what she needed.
Right.
And she was afraid to kind of stand up for herself because she was afraid she'd never get a job in the industry again.
Right. Right. Or be labeled, a
Mhm,
troublesome employee or troublesome woman or whatever the label might
mhm,
be. But standing up in the best of circumstances can be incredibly challenging, but
mhm.
standing up in the middle of a cancer battle
Exactly.
feels almost impossible.
Almost impossible,
Almost, I will say almost, yeah.
and women are being, women are being tasked with doing this kind of standing up for themselves
Mhm.
because have we don't have great supports to fall back on,
Yeah, I agree with that. I agree with
right?
that. Hey, you guys, I wanted to tell you about one of my favorite healthy hacks, and it's a fat hack. Okay, first of all, I've been around for a long time. I'm going to admit that. And I had a practice back in the mid 90s. And honestly, the science back then, I say science with quotation marks, was don't eat fat because eating fat will make you fat. Well, fast forward to 2024, I'm so grateful that now we know that eating good, heart healthy fat is one of the best things you can do for your body. So, people ask me, what do I cook in? I cook in ghee. That's spelled Ghee. Ghee has a 485 smoke point, which means I can cook at pretty high temperatures and I'm going to be just fine. That fat's not going to oxidize. It also has a broad spectrum fatty acid, along with butyrate and conjugated linoleic acid. I know those are a lot of really big words, but let me tell you, the brand that I love the most, and this is the one that's always in my pantry, Ancient Organics Ghee. I love this company. They make ghee the old-fashioned way, which is the right way. And ghee is basically clarified butter. But their butter they get is all grass-fed, which increases butyrate. Butyrate will help to aid digestion and help to increase your digestive health. Conjugated linoleic acid, that's that really big phrase, can actually support your cardiovascular health. And one of the things that I love the most about using ghee is it also can help to calm inflammation. And as I've spoken about it before, inflammation is basically the root cause of just about every disease known to man. So, again, my favorite brand, Ancient Organics Ghee. I love the way they do things. You can get this product on Amazon, some Costco's, and usually your local specialty supermarket. So enjoy. I had a moment during my care, actually, I had multiple moments where it was recommended, highly recommended to take a medication for 5 years post
Mhm.
breast cancer. But I have a condition that it appeared to be it would really worsen my symptoms of dry eye.
Mhm.
And, I kept bringing that up, and they kept not listening to me. And I really felt like, when I was in that office, and my husband was there too, that the doctor was just reading from a script. like the script that they got that was inside the medication. And I said, look, I'll take your prescription. I'll take it. I'll get it filled, but I don't know if I'm actually going to take it. And here are my reasons. And I stated my reasons. They were well researched. She was not happy with me. And then I thought, you know what? I don't need people who are not happy with me on this journey. So I let her go.
Mhm.
And I asked for a different doctor, a different medication oncologist. I met with him and I got multiple opinions before I made my presentation to him. Met with him. I stated my case and he said, you know what? You're actually right. And this is you've done a really good job, well researched, convincing me. And he said, I will not recommend this medication in your case. I'm not saying for every case, but
Mhm.
this cancer is very individual. So please hear me, whoever's listening. But this is the type of conversation that you can have.
Absolutely.
You can have this. Let's just grant you permission right now on this podcast. But I will say that I thought, oh, I'm going to be labeled as a troublemaker. And I thought, you know what? Uh, I don't care. It's
So
my
what?
body. So what?
Mhm. So what?
Troublemaker, bring it on.
Yep.
Yeah.
Right, exactly, and ultimately, ultimately, it's your insurance that is
Mhm.
paying for your care, and, I think that the breast cancer industrial complex, forgets that the providers are in medicine as service providers. That's why I
Mm.
went into medicine. I went into medicine because of a need to be of service.
Mhm.
And so in my mind, there have to be collaborative, respectful relationships between patients and providers. And I mean, it's tough, providers are burned out. They have
Yeah.
all this like really uncomfortable structure that they have to work within. They don't have a whole lot of time. They know probably intellectually all the things that a woman might need or does need, and they're
Mhm.
human and they forget that, oh my gosh, I should have referred that patient for
Mm.
a, pre-mastectomy physical therapy appointment so that
Mhm.
her upper arm can get measured in the hopes that we can prevent lymphedema, right? Like that stuff gets forgotten all the time. And
Yeah.
right, and so there needs to be a collaborative agreement, and really not only can women with breast cancer ask questions about their individual care, because really it should be individualized despite what the data say,
Mhm.
but you can choose your own team. If you don't like
Yes.
your provider, you can
Let
ask
them
for
go.
somebody
Right.
else.
That's exactly what
Right?
I did. And at first I just thought, who am I? And then I thought, yeah, this is me and this is my life.
Mhm,
And when you know your quality of life, I will say my life wasn't at stake, but my quality of life was at stake. And
mhm,
I fought for it. And I just really
mhm.
encourage today to
Yeah.
if something feels off inside and a doctor is saying, "Hey, you might want to consider," or maybe not, you might want to consider, "You need to do this or you should do that." That might be a red flag for you. And just
Mhm,
think, "Do I need to do that? I'm going to do a little bit of research. I'm going to think, I'm going to pray, I'm going to get a second opinion." And if
mhm,
it doesn't feel right, ask questions.
mhm. I think, we're in this era of a lot of information on the internet, right?
Mhm.
And, as much as I encourage people to find support, and sometimes that support is like a Facebook group, um, all of that needs to be taken with a grain of salt,
Very
and
good point.
right?
Mhm.
And, I've had so many women come to me just scared because they've read whatever it is on the internet or in their support group, or, their cousin had cancer and had this, that, and the other thing and didn't do well. And, there is not just one cancer, right? There
Right.
are all of these permutations within different types of cancer, breast cancer being one of those types.
Mhm.
And so you can't make blanket statements. And really everything that's out there on the internet needs to have a critical eye. And so this is why your in-person team really matters,
Yeah.
because you want your providers to help you sort through all that stuff,
That's
right?
right. That's
You
right.
know?
And they told me over and over, every cancer case is different.
Mhm.
So the treatment I got is not gonna be like anybody else's that I
Right,
know, or,
right.
because it depends on stage and grade and, you know, I mean, all the things that go into it. So I think our big takeaway here is continue to ask questions and, just whatever you can do to just step through that fear and ask the question is a really good choice.
Yeah,
Yeah,
absolutely. I agree
yeah.
with that.
So we've talked a lot about the, breast cancer industrial complex, and how do we start to change that system?
That's a really good question. Um, I think that asking questions is where we really need to start.
Hmm,
Um, and in terms of these large organizations that are sort of processing women who have breast cancer, I mean, that's
mhm.
kind of what it is,
Yeah.
it's processing. Um, the more they hear from patients about what their needs are, the more likely there might be some implementation to support those needs.
Hmm,
Now, that depends, right? I mean, it's taken over 20 years for a large academic medical center in Washington to actually develop a department of integrative oncology, right?
okay.
So, and a lot of that came out of patient request, right? So it
Hmm,
can take a long time for those things to really get plugged in, but, in terms of, conversations and support groups, or, getting more referrals to different types of providers, asking questions, asking for more information, asking for referrals starts to kind of change some of the mindset.
hmm,
Um, I think that, part of what I struggle with as a naturopathic oncologist is that, less there's a lot less money for clinical trials when it comes to natural products
hmm,
than there is money for pharmaceutical trials. And
hmm.
so the data that we get in the breast cancer industrial complex is driven by pharmaceutical investment, right? Or medical
Yeah,
device investment, right?
yeah.
So, the problem is so big and so difficult, that I'm not sure we can change it easily at a big level, right? It's sort of like the whole thing is this, it's like a battleship and it's very hard to
Hmm,
turn a battleship.
okay.
But there is some good evidence that resilient women do better, right? There's a
Mhm,
lot of evidence that certain integrative strategies improve long-term outcomes, like exercise, for
mhm,
example. You know, and doing those things which you have complete control over, um, can start to shift how women are being treated.
hmm,
Right? We're starting to see some shifts in how women are being treated from a medical standpoint, avoidance of surgeries, avoidance of chemotherapy. We have more and more tests that are coming out that are well validated that can tell us if someone needs chemotherapy or not. For example, the Oncotype DX is a
mhm,
great test. There's also Mammaprint, which is similar. But that can have some predictive value in terms of how much treatment a person needs, right?
Hmm. Hmm.
There's a test called the Breast Cancer Index, which is done at 5 years post treatment that looks back on tissue from the original tumor and can predict whether or not a woman needs to continue anti-estrogen therapy beyond 5 years.
Hmm.
So each one of these things has its own parameters. And
Mhm.
so a given woman with breast cancer could meet those parameters or not, and that dictates whether or not insurance might pay for those tests. But I think that the testing can be really important in terms of how women are being managed by the system. And
Mhm.
so asking for tests is also
Hmm.
an important piece. Let me see if I really, do I have the genes that are predictive of needing to take chemotherapy, right?
Right,
Like
right.
that one's almost a knee jerk test that's
Mhm.
ordered these days, but for a
Okay.
long time it wasn't.
So these tests are available, and they're probably covered by insurance in
Many
most
of them are.
many of
Yes.
them are. Okay. Do you see a difference in care with women, say, in Bellevue, Washington versus, a lower
Absolutely.
socioeconomic area? And are
Yes.
these tests available to them as well?
So the tests are theoretically available through any conventional hospital cancer care setting.
Mhm.
Um, Not necessarily all the tests all the time, but certainly a test like Oncotype DX is really available for everyone who qualifies, right? And
Okay.
what I mean by that is, it depends on stage. It depends, there are
Right.
all these different sort of pathology related things that might qualify you or not. Um, Absolutely, someone treated in Bellevue, Washington is gonna have a different level of care than women who are treated in a regional cancer center in a smaller area in the country.
Mhm.
And part of that has to do with the number of basically job titles that are part of that cancer system, right? I mentioned nurse navigators. Not every facility has a nurse navigator.
Right.
Not every facility has a medical oncologist who is a breast oncologist,
Mhm.
right? In Bellevue, in the greater Seattle area, we have quite a few conventional medical oncologists who only work with women who have breast cancer,
Hmm.
right? That's going to provide a whole different level of
Whole
care.
different level of care.
Mhm.
Interesting. So, have we seen with COVID that, maybe I live in a small rural area, I don't have great health insurance, but can I do virtual appointments to get the same level of care that I got in Bellevue, Washington?
Yes and no. It
Okay.
depends on what's being sought. I know that many of the very big academically focused major medical centers, like University of Washington, Fred Hutch Cancer Research Center,
Mhm.
they're a complex, MD Anderson, University of Texas, I wanna
Right.
say,
Mhm.
all these bigger organizations, Dana-Farber, which is related to Harvard in Boston, um, they will do virtual second opinions, um, and they will solicit all of the information that might exist for your case, um, and then review it with you if you can't go to their facility. So,
Mhm.
the gift of COVID really has been the opportunity to do telemedicine,
Right, right.
right?
So I just wanna know I just wanna let people know that,
Mhm.
if you are that person who is in a very rural area, don't don't just give up.
Right.
There are second opinions to be had. They're gonna be virtual,
Mhm.
but at least you're gathering more information. And you talked earlier about mindset. And when my mindset started getting better during my cancer journey, it's when I started asking questions because
Mhm.
I had to kind of put the fear in a box and
Mhm.
focus on how I wanted to feel and how I wanted to be healed and all of those things. And so once I started feeling a little bit more courageous and asking my team more questions, that's when my mindset just it shifted. My attitude was better. And you talked about that locus of control.
Mhm.
And that's what I regained instead of just feeling like I was bumping along on the bullet train. I stopped. I pulled the bell and made the train stop and asked some questions.
Yeah, yeah. When it is one of the worst feelings in the world to have something done to you,
Oh, isn't that the truth? Yeah.
right?
Yeah.
And that is a complete, um, you're not on board with letting go of your autonomy really
Mhm.
at any point in time.
Mhm.
And this concept of autonomy, of having a locus of control, making your own decisions. Unfortunately, we live in a society where as women we have to fight for that autonomy.
Yep.
Um, but we're doing it. We are fighting for our
Mhm.
autonomy like our ancestors fought for the vote,
Right, right, and we
Um,
have to, and I think the sooner
mhm,
we just realize,
mhm.
"Look, we just gotta fight. We have to
Right,
fight." And
right.
you as soon as you
We do,
accept that and
we do.
realize, I think it just becomes a little easier because it just then
Yeah,
becomes part of your I'll just say it, becomes part of your personality of just
yeah.
asking more questions
Yep,
and standing your ground
yeah.
if your ground needs to be stood on.
I think that, my best friend, as one's best friend really should be, says things that are just kind of the truth, right? And
Mhm.
my best friend said to me recently, "Laura, life is hard. Once you just accept that life is hard, it gets easier to make the choices that you need to make within that."
Hmm.
And she's absolutely right. And I came across a photo on Facebook the other day that was sort of, it had a bunch of different topics, but the idea was choose your hard. Each choice you make is hard. You can choose which one you're going to deal with, though. So, cancer treatment or risking having a more advanced cancer, both of those paths are hard.
Yeah.
Choose your hard, right?
Wow. That is something I'm gonna have to really think about, but you're right. Every life 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 is hard,
Hard. It's
and
hard.
as soon as you accept it, you're right. You get to choose the path, but when that path is taken away from you and chosen for you,
Mhm.
that goes to a whole different level of hard.
Exactly.
Yeah.
Exactly. But before can I add one thing before we get too far away from
Yeah,
the
absolutely.
conversation we had about, getting a second opinion and asking
Mhm.
questions? I know that some of your listeners might be in rural areas and may have been diagnosed, and maybe they have their treatment started at smaller, more regional centers. Every
Mhm.
single state in this country has a major medical center that's academically connected in probably capital cities or other large cities, but every single state is going to have an option where there will be breast oncologists,
Hmm.
very targeted individuals. So people don't always have to go out of state, which can
Mhm.
then be an insurance issue for women.
Right. Right.
People can go, it might be a 4-hour drive, but it may very well be worth it. Or your team in your local regional center might already be in conversation with the folks at the university of whatever center,
Mhm.
right?
Okay.
So there are those options and you can request them too.
Mhm. Okay.
I just
Okay.
want to make that little
That's
mention.
yeah, no, that's a really good point because it was pretty easy for me to just walk into my breast cancer center in
Mhm,
Washington
mhm,
State and just knew I was
right.
gonna get great care and top of the line, most well researched. But yeah, if I was living in a small rural town, to know that each hospital is connected somehow and that I can ask for those resources.
Yeah.
Yeah, okay. Any other advice that you might have of how to ask questions, or are there online resources for women of maybe the right
Absolutely.
questions to ask? Yeah.
Yeah, absolutely. There are a ton of resources, and without sort of having a list in front of me, it's hard to talk about all of those. But it really depends on what your questions are around. And a
Mhm.
good place to start is usually breastcancer.org,
Okay.
particularly as a woman is learning the language of breast cancer,
Mhm.
right?
Yep.
Um, Questions that are asked in the right language generally are answered better than questions
Mm.
that are not asked in the right language.
Oh, that's
And
so interesting. I had never considered that. Okay, so
mhm.
get the lingo down first.
And familiarize yourself with what the procedure name might be, what the chemotherapy name might be. Not all chemotherapy is the same.
Mhm.
Not all surgeries are the same. Not
Yep.
all, there are all these different pieces to the puzzle, which someone might feel, sort of overwhelmed by scientific terms, but it's really in your best interest to learn what they are because they're
Mhm.
going to be done to your body.
Right.
Right?
Right.
And each of those individual things also is going to have its own kind of set of questions around it,
Mhm.
right? So I think that starting with some terminology, which you can find on breastcancer.org, you can find through the Susan G. Komen Foundation. There are a lot of websites, American Cancer Society, National Cancer Institute. There are all these big organizations that help you learn. It's sort of like like breast cancer 101, right?
Hmm.
Coursework.
That's really helpful. Yeah, because I remember my mom bought a book and, we were both reading it, because she had flown up to help take care of me with all the surgeries, and we were both reading it and just, like, figuring out the lingo, like, "What do you have again?" And how and just and you're
Mhm.
right, it made conversations with my team easier.
Right. And if you don't feel necessarily up to that kind of level of study, um,
Mhm.
grab a friend or a family member who can be your objective ears and take notes. Um, I can't tell you how many groups of people I've had in my office when they come about a patient. And, it helps to have an extra set of eyes, an
It
extra set of
does.
ears to kind of have a buddy, to pay attention to what you might miss because you're in overwhelm and you're in a place of fear and anxiety. Having someone who's
Mhm.
not in that place of fear and anxiety is a great resource.
It
Um,
really is, yes.
so, learn the language, start with some of the basic websites, and then depending on what you're interested in. So, if someone is interested in integrative medicine as part of their program, I'm part of the Oncology Association of Naturopathic Physicians. There are about 130 of us in North America, and ONC-ANP is a great place to find. One of my colleagues for care. Um,
Mhm.
ONC-ANP also has a great database called the KNOW database, KNOW. And that's a terrific resource for information, scientific information about different integrative therapies. Um, and so, if you wanna do some research on things you might have seen elsewhere or heard about elsewhere, that's a great
Mhm.
place to go. And then
Okay.
depending on your circumstance, and this is where someone like a nurse navigator or a social worker at your facility might be helpful with different resources about childcare options,
Mhm.
transportation options, meal options,
Yep.
navigating workplace issues. And then there's this great organization called, I think it's called triagecancer.org. And it's a pair of sisters who are lawyers who give free legal advice for women with breast cancer who run into whatever legal issue it might be.
Oh my
They're there for you.
gosh.
Mhm.
Okay, so that was a lot. And what I'm going to do is we're going to work together. We're going to get this list together and everything will be in the show notes because that's brilliant because the last thing you want to be battling
Mhm.
is some sort of a legal battle
Mhm.
in the middle of breast cancer treatment.
Right.
And wow, God bless those sisters to do that.
I
That's
know, right?
that's amazing.
Yeah.
That's amazing. So, boy, you have offered us some great resources today, and it was just a really empowering conversation. Which I think sometimes going through any type of treatment for an illness, it strips you of your power and in some cases your dignity. And I feel like today's conversation really brought that back. So thank you, Dr. Laura James.
You are more than welcome. Thank you so much for having me on your show again.
Yeah,
If folks are interested in following me, I'm on Instagram, follow me on Instagram. And I have a free newsletter, which people
which
can
is
sign up
great.
for
Yes, I love your
on my
newsletter.
website.
Yep,
And
yep.
I try and bring interesting topics, great resources, and, upcoming events and things like that on my
Mhm.
newsletter. And that's totally free.
Great.
So,
And I will also put that in the show notes.
mhm,
Yeah,
yeah.
great. Thanks, Dr. James.
You're
Wonderful
welcome.
talking to
Nice to
you.
see you. Okay.
Hey, you guys, you know by now that I'm a huge fan of salmon. I try to eat it at least 2 to 3 times per week. It's just fantastic for an anti-inflammatory diet, and I love the omega-3s that I get out of it. But here's the deal. I just found out that most salmon that you buy in the freezer section of the supermarket has been double frozen, meaning it's fished, it's frozen, it's defrosted, it's processed, frozen again, and then it lands on my plate. And you know what? I'm not okay with that. And when you freeze protein and then defrost it and freeze it again, you get texture changes, you get flavor changes, and the nutritional content is also going to change. So after I heard that, I reached out to my friends at ButcherBox and I said, hey, what gives here? And tell me about your salmon. And I was assured by ButcherBox that their salmon is frozen one time. And I am a big fan of that. And that's probably why their salmon tastes so good. So they have a great deal for my community right now. And you can get free salmon in every box for a year. That's 2 pounds of salmon, $20 off of your first box. And you just go to butcherbox.com/Enos and then use the code Enos to get this deal. Yes, I know that's a lot of the word Enos. Anyway, moving on. I don't know how long this deal is going to last. I'm a big fan of salmon, as I mentioned, but I'm a big fan of really delicious salmon. And I love that it comes from Bristol Bay, Alaska. It's sustainably harvested, and they actually even have a way to track it. So you can track it coming up from Bristol Bay all the way to your plate. So hope you enjoy this deal. Hey, y'all, can you do me a favor today and go and leave a review of this podcast? I know that the more great reviews, wink, wink, emphasis on great, reviews that I get, along with more downloads and more subscribers, that pushes this podcast out to people who might normally not even find it. And the reason I started this podcast and my real heart for starting this podcast is that I needed this information. It wasn't available. And so I started a podcast so that I could be a blessing to others. So you're a blessing to me just by being here. And again, thank you for your support. Thank you for your positive reviews and all of the notes that you send me. And also just wanted to say, hey, keep in mind, I'm not a doctor. And if you need medical advice, please reach out to your team. That is going to be just the best source for you because they know you. So again, I hope you enjoy this podcast.